is the life cycle of the heartworm?
The life cycle of the heartworm includes mosquitoes, and so a mosquito susceptible to infection by Dirofilaria immitis has to bite an infected dog that currently has microfilaria circulating through its bloodstream. Once it does that, it actually will bring up those microfilaria into its body, and in its body they're going to mature through a few phases of larval growth. Once they reach the infective phase, which is stage 3 larva, they then move back down to the mouth parts of the mosquito. So when it bites another dog, it will then transport or transplant those infective larvae around the bite wound of that pet that has just been bitten. And then those microfilaria, or those stage 3 larvae, will move into the tissues of that dog through the bite wound produced by the mosquito as it was taking its blood meal. Once in the tissues of that dog, they're going to go through another phase of maturation as they migrate through the musculature. Eventually they're going to arrive in the lung tissue, in the vessels of the lung, and there they're going to be considered juvenile adult heartworms. As they live in the vasculature of the lung tissue, they're going to continue to grow. If there are male and female heartworms present, then they can now create new microfilaria that can be picked up by another mosquito. They're going to continue to grow in the vasculature, and as they start to elongate, they're going to need bigger and bigger blood vessels in order to be able to accommodate their size and the resulting larger worm burden as additional heartworms mature. Once they get to a mature phase and they're big enough and say the worm burden is large enough, they can actually start to reside within the right side of the heart. So the main pulmonary artery, the right atrium, and even the right ventricle can be affected. And so what your mosquito is going to end up be picking up from the dog are these little microfilaria that have been produced by the male and female heartworm as they breed.